encouraging the state legislature to ban conversion therapy.
Move.
Second.
If I could, I just would like to talk a little bit about this. First of all, I'd like to thank all the members from Safe Schools and their board, as well as the other schools, for their support of this. This is an issue that has been around for a number of years, and we actually did pass a ban in the state legislature and the Democratic-controlled Senate, which was not then taken up by the House. And I think this is the direction that states are wanting to move. It is something that's been done in a bipartisan way. I think Governor Chris Christie was one of the first governors to sign a ban into law in New Jersey. What this says is, whereas according to the nation's leading medical and mental health organizations, the term conversion therapy refers to any practice or treatment that seeks to change the sexual orientation or gender identity of a patient or client. And whereas these practices and treatments, which are also known as reparative therapy, sexual orientation change efforts, or gender identity change efforts, include practices or treatments that seek to change, eliminate, or reduce behaviors, expressions, attractions, or feelings related to a client or patient's sexual orientation or gender identity. And whereas conversion therapy has been associated with high rates of depression, suicidality among minors, and whereas conversion therapy has been disavowed by the nation's leading medical and mental health organizations, including but not limited to the American Academy of Pediatrics, the American Academy of Child Adolescent Psychiatry, the American College of Physicians, the American Medical Association, the American Psychiatric Association, the American Psychological Association, the American Psychoanalytic Association, the National Association of Social Workers, the American Association for Marriage and Family Therapy, and the American Counseling Association, and the American School Counselors Association. And whereas the Polk County Board of Supervisors also acts as Polk County's regional mental health governing board and Polk County's Board of Health, and whereas the Polk County Board of Supervisors joins with the community partners and medical and mental health professionals in seeking solutions to reduce rates of depression and suicidality impacting our community, and whereas the state of Iowa has a responsibility to protect minors from harms inflicted by conversion therapy, now therefore be it resolved that Polk County urges the Iowa State Legislature, the governor of the state of Iowa, to adopt a statute that protects minors from conversion therapy by prohibiting licensed mental health therapists from subjecting minors to these harmful and discredited practices, and that a signed copy of this resolution be sent to the governor of the state of Iowa and the Speaker of the Iowa House of Representatives and the President of the Iowa Senate, and all members of the Iowa legislature who represent any constituents who reside in Polk County. As I think Joby indicated, there's a variety of methods that are being used to inflict this child abuse on minors, and all of the results are the same, but they're all very bad for the child. It's interesting to me in conversations that I had with youth emergency services that about 40% of our homeless youth are identified either as LGBTQ or somewhere on that spectrum of questioning, and oftentimes find that they're not welcome at home. I know what it's like to not be welcome at school. I know what it's like to not be welcome in organizations that I once was a part of. But not being welcome at home is unimaginable pain that these children suffer, and they become our youth that are homeless, and many of them get engaged in drugs and used in the sex trade, and it becomes a never-ending cycle of pain and, just a horrible existence. So I believe this is a step in the right direction. Education is the only way we can stop and end this horrible practice. And we will continue to try to reach out and try to educate Iowans on the harmful impact of this type of therapy and ask that this practice end. And I think we should send an affirmative 5-0 vote today to do that. Thank you.
Matt, I think it's really alarming what you just went through and said and what these folks on the chat has reported to us. I think you're right to educate and to continue to advocate for this. And the only way to do that is to pass resolutions like this and send a message to the Iowa legislature. It's hard to say how they will react, but I can't imagine what these children go through, just from our own experiences with mental health and the trauma that all the shortages that we have with mental health therapists. This is just one more added thing that they have to worry about with these kids on what they're going through with COVID and just life in general, and then to throw this on top of it is something that is really unimaginable. So I will definitely be supporting this resolution.
Angela, I'm inclined to support this, and I did have one, I guess, pause in this resolution as it went forward, and I've had numerous conversations with Supervisor McCoy about this, and I think I've gotten past it, but my concern was we're not passing laws here. We're basically advocating for something, and I want to be sure that we're advocating for what we're not advocating for. What we're not advocating for is the elimination of all therapy, just this brand of therapy. And I'm glad that Mr. Holcomb is here to give us his point of view. I haven't had a chance to talk to David about this yet, but I think Matt points out to me that this is not the intent, that therapy for credentialed professional therapy, that is of value to people, whether they're adolescents or adults, whether they're LGBTQ or not. Therapy is a value, and I don't want to send a message that we're advocating for the elimination of all therapy, because adolescents need this therapy. If they're exploring things they don't understand, it's best not to keep it inside your own head. And so I'm convinced after talking to Supervisor McCoy that we've taken that we're not advocating for that. We're advocating for just a certain kind of therapy here, that if you want to call it therapy, then I'm comfortable with that.
If I could, Bob, I would just say that on that point, and I think that's an excellent point, most families and most individuals that are engaged in the coming out process do turn to licensed therapists for support, counseling, and therapy as they try to understand how they can accept who they are and how they can become comfortable in their own skin. And it is a great therapist that will help an individual emerge from the coming out process stronger and more confident in their own sexual orientation. And so that's a necessary part of the coming out process. So I appreciate that.
Thank you, Supervisor.
Okay. Roll call.
Van Orn,
Yes.
Brownell,
Yes.
McCoy,
Yes.
Hawkinson,
Yes.
Conley.
Yes. Okay.
Number 15,